The Cattlemen's Ball, as was mentioned earlier, is now celebrating its 21st Cattlemen's Ball. I've been to 20 of them, so the only one we didn't come to was in 1998 before we moved to Nebraska. But as the mayor pointed out, I moved to Nebraska with my family, daughters who were 9 and 12 at the time, and we actually came out earlier than August to the June Ball out in Lexington in June of 1999 on the Robb Ranch. And so we got to experience actually Nebraska firsthand in central Nebraska and rural Nebraska very early on. And my daughters came to that ball, and they've been to several balls since. My wife and I have been to every Cattlemen's Ball since then. It's an incredibly fun event. Obviously, they'll hope to host about 4,500 people at the event. They've had, as they said, already 600 volunteers already registered. By the time they host the event, there'll probably be 750, almost 800 volunteers. So if you add up 800 volunteers times 21 years of people putting this on and 4,500 people attending the ball every year, then work backwards, as you mentioned, how much free time the volunteers put into this. They started working on this at last year's Cattlemen's Ball over a year ago, in last June. So the volunteers have been now working for almost a year to put this year's event on. So again, you calculate on all the number of hours that everybody's put forward to work on this, to highlight, again, the beef and agriculture industry of this great state. The beauty of Nebraska, which again, the mayor points out, I'm originally from New York, but I have my first generation granddaughter living here in Nebraska, born here right in this med center here, and 2 years old last month. So my wife and I are very proud that we'll definitely be, we're Nebraskans by choice, but we definitely have our own first generation Nebraskan already here. But part of the beauty of the Cattlemen's Ball organization, again, is highlighting the beauty of rural Nebraska in particular, but all parts of Nebraska. And I'm proud to say that at the 20 balls that I've attended, I've visited more beautiful spaces and places in Nebraska than most people who are unfortunately 4th or 5th generation in Omaha have not yet had the privilege of seeing. And so I really try to emphasize and promote this event because it really is a weekend of fun in a beautiful part of Nebraska that most people who don't get off of Route 80 have a chance to visit. It really is a beautiful state. And you can see from these pictures that there's lots of beauty across Nebraska and lots of people who are just so kind and giving to this. As was pointed out, 90% of the money raised at each ball has gone to the Fred and Pamela from previously the Eppley Cancer. It goes to our cancer to support research, and it's been over $13 million raised already to support the Cancer Center research. We'll tell you a little bit more about it. 10% again stays in the local community to support local healthcare activities and benefits, fire department, emergency rooms, etc. So it really has raised a lot of money for parts of Nebraska as well. The Cancer uses the money to help recruit faculty, to help faculty get initial startup grants. We call them pilot grants to apply for more national grants, higher priced national grants. 100% of all the dollars raised by the Cattlemen's Ball and given to the Cancer, we transmit directly to the researchers. We take no overhead, there's no taxes. Every dollar raised through philanthropy goes directly to support research. When I came here in 1999, so this building just opened up last June. I'll tell you a little bit more about that in a second. I won't go too long, but when I came here in '99, there was a cancer research activity here. We had about $19 million in research funding coming into the cancer to support the grant. With the help of Cattlemen's Ball money and other philanthropy, we've been able to recruit over 200 new faculty members in cancer, both clinical faculty members as well as research faculty. And the research faculty have been applying for research grants, and this year we actually are bringing in over $65 million annually this year to support the cancer research activities. So over a threefold growth in the research funding. And again, all that money gets spent here in Nebraska to hire more people to work in laboratories, as well as supplies and services. So it has an economic impact on the community of over $150 million just on the research side. If you look on the clinical side, we're a larger cancer organization. This hospital is allowing us to see more and more patients, and that also has a tremendous impact. This building was almost 10 years in envisioning, 5 years of planning, and then broke ground 3.5 years ago. We'll get to tour it. Anybody wants to come visit upstairs and see the beauty and also the impact that this building is having on patient care and cancer research. We're happy to give a tour afterwards as well. Again, the mayor and the city have been very supportive of helping us to build this building by contributing $35 million from the city of Omaha. Governor Heineman was governor at the time when state legislature, and he provided $50 million to support the cancer research tower that we're sitting under today. Overall, there was $90 million in public dollars for this research tower, but over $190 million in private philanthropy to put up this $350 million building. This is the largest public-private partnership in the history of Nebraska, the state of Nebraska. And I tell everybody that it actually was because of our relationship with the Cattlemen's Ball in every single county practically of Nebraska, impacting families and friends and patients with cancer across the entire state, that allow us to go to the state and the city to say that this really was something that was important for everybody in Nebraska, everybody in Omaha. So it's a building that actually integrates everything in cancer research. We have 100 new laboratories in cancer research right above us, and a cancer hospital that's also part of this on the north side of the building. 108-bed cancer hospital, a full multidisciplinary clinic where a patient walks in here, makes one appointment, gets seen by every single person they need to see: doctors, nurses, pharmacists, genetic counselors, dietitians, etc. So it really is a convenience for everybody. The whole purpose of this building is to provide not only exceptional cancer care for everybody, but also to provide unlimited hope through the research that's going on here, that new therapies are being developed to eradicate this disease. As was pointed out, every single person in Nebraska, every single person in America is affected by cancer. 1 out of 2 Americans will be diagnosed with cancer in their lifetime. And when we come to the Cattlemen's Ball, there'll be 4,500 people under the tent. We usually ask everybody who's been affected by cancer one way or another to stand up, and the entire 4,500 people will be standing that night. And every year you go to a Cattlemen's Ball, you meet people and families and their friends who have been touched by cancer, and the stories just keep accumulating. Despite the fact that more and more people are being diagnosed with cancer every year, as we live longer, it's just a natural process, unfortunately, that the longer you live, the more risk you have of getting cancer. But also every year, more and more people are surviving this disease. So research has led to better ways of diagnosing it early and better ways of treating it. So there'll be 15 million Americans alive today, and many of them will be at the Cattlemen's Ball. Many cancer survivors will be there. We anticipate by 2020 there'll be over 20 million Americans alive as cancer survivors. So research is really leading to new opportunities and better hope, and we really appreciate the role that the Cattlemen's Ball has actually played in helping to build this facility and build a cancer program. We have relationships with hospitals across the state, from here to Scottsbluff, Grand Island, North Platte, Hastings, Grand Island, Lincoln, Norfolk, etc., to help to initiate any clinical protocols that are being done here that can be done in the local communities. We try to work with the local cancer centers and providers to make sure that our protocols are available to everybody across the state.